Hello, I'm Dr. Maurie Markman from City of Hope, and I wanted to briefly discuss, I think, a very important paper. Again, one that probably didn't get as much attention as I believe it should. That looks at a very important, clinically relevant question, and one that might very much say, can we do more such studies, but only do them faster? This was a trial uh, reported in the Journal of Clinical Oncology. In earlier this year, 2024, entitled Radiation Therapy with or Without Cisplatin for Local Recurrences of Endometrial Results from the NRG Oncology GOG Prospective Randomized Multicenter Clinical Study. Fortunately, most patients with endometrial cancer have low-grade cancers and are cured with standard surgery plus or minus radiation. However, a small percentage of patients, even with low-grade endometrial cancer, will recur. So there are several questions that come up. What is the optimal therapy? What is the outcome for such patients? Should we perhaps give chemotherapy along with the radiation as we do, for example, standardly in cervix cancer? So this study attempted to address that question. There were a total of 165 patients randomized in this trial that went for 12 years, looking at local radiation versus radiation plus cisplatin, which is, again, as standardly given, chemoradiation in cervix cancer. Or the results. Well, when this paper was reported 16 years after the study was initiated, the results showed the addition of chemotherapy did not add to the benefits of the radiation, in fact, increased toxicity. But very importantly, the local control and overall control of the disease was excellent. In fact, at 3 years, 73% of the patients treated with radiation alone were disease-free. So again, very important study, very important to know this, very important to know the value of radiation, very important to know that adding chemotherapy with radiation doesn't make a difference. But one might ask this is an important question. It's an important clinical question. Is there a way, would there be a way in the future to take a question like this and significantly expand the population of individuals, the population of oncologists that might participate, community-based studies? They're asking a very simple question. You radiate versus something else, get a standard of care, looking at PFS, which is a very valid endpoint, overall survival. You don't anticipate significant difference in toxicity because you might use this therapy otherwise. But to answer the question, not in 12 years, but in half that time, or maybe 20% of that time, because the results are important for patients being treated today and their doctors who are advising on optimal therapy is. For those of you who are interested in the question of the management of endometrial cancer, this type of very pragmatic type trial, I would encourage you to read this important paper. And I thank you for your attention.